Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about Medicare final rule for hospital outpatient prospective payment system and ambulatory surgical center payment system for calendar year 2023. Let's dive right in. On November 1st of 2022, the Centers for Medicare and Medicaid Services, or CMS, finalized Medicare payment rates for hospital outpatient and ambulatory surgical center, or ASC, services. The calendar year 2023 Hospital Outpatient Prospective Payment System, or OPPS, and Ambulatory Surgical Center Payment System final rule is published annually. In addition to payment rates, this year's rule includes policies that align with several key goals of the administration, including addressing the health equity gap, fighting the COVID-19 public health emergency, or PHE, encouraging transparency in the health system, and promoting safe, effective, and patient-centered care. The final rule advances the agency's commitment to strengthening Medicare and uses the lessons learned from the COVID-19 public health emergency to inform the approach to quality measurement, focusing on changes that will help close the health equity gap. Some of its takeaways are as follows. Updates to outpatient prospective payment system and ambulatory surgical center payment rates. In accordance with Medicare law, CMS is updating outpatient prospective payment system payment rates for hospitals that meet applicable quality reporting requirements by 3.8%. This update is based on the projected hospital market basket percentage increase of 4.1%, reduced by 0.3 percentage point for the productivity adjustment. In the calendar year 2019 Outpatient Prospective Payment System / Ambulatory Surgical Center final rule with comment period, CMS finalized a proposal to apply the productivity adjusted hospital market basket update to ambulatory surgical center payment system rates for an interim period of 5 years, which is from calendar year 2019 through calendar year 2023. Using the hospital market basket update, CMS is finalizing a productivity adjusted hospital market basket update factor to the ambulatory surgical center rates for calendar year 2023 of 3.8%. The update applies to ambulatory surgical centers meeting relevant quality reporting requirements. This update is based on the hospital market basket percentage increase of 4.1%, reduced by 0.3 percentage point for the productivity adjustment. Rural emergency hospitals, new Medicare provider type. There has been a growing concern that closures of rural hospitals and critical access hospitals are leading to a lack of services for people living in rural areas. Section 125 of the Consolidated Appropriations Act of 2021 established a new Medicare provider type called Rural Emergency Hospitals, or REHs, effective January 1st of 2023. Outpatient prospective payment system payment for drugs acquired through the 340B program. Section 340B of the Public Health Service Act allows participating hospitals and other providers to purchase certain covered outpatient drugs from manufacturers at discounted prices. In the calendar year 2018 Outpatient Prospective Payment System / Ambulatory Surgical Center final rule with comment period, CMS re-examined the appropriateness of paying the average sales price, or ASP, plus 6% for drugs acquired through the 340B program, given that 340B hospitals acquire these drugs at steep discounts. Beginning January 1st of 2018, CMS adopted a policy to pay an adjusted amount, generally ASP minus 22.5%, for certain separately payable drugs or biologicals acquired through the 340B program. CMS continued this policy in calendar years 2019 through 2022. For calendar year 2023, CMS is finalizing a general payment rate of average sales price plus 6% for drugs and biologicals acquired through the 340B program, consistent with their policy for drugs not acquired through the 340B program. As required by statute, CMS is implementing a minus 3.09% reduction to the payment rates for non-drug services to achieve budget neutrality for the 340B drug payment rate change for calendar year 2023. CMS will address the remedy for 340B drug payments from 2018 through 2022 in future rulemaking prior to the calendar year 2024 Outpatient Prospective Payment System / Ambulatory Surgical Center proposed rule. CMS notes that claims for 340B acquired drugs paid after the District Court's September 28 of 2022 ruling are paid at the default rate, generally ASP plus 6%. Payment for non-opioid products under Section 6082 of the Support Act. Section 1833T22A and Section 1833I8 of the Social Security Act as added by Section 6082A and B respectively of the Support Act require that the Secretary must review payments under the Outpatient Prospective Payment System and Ambulatory Surgical Center for opioids and evidence-based non-opioid alternatives for pain management with the goal of ensuring that there are not financial incentives to use opioids instead of non-opioid alternatives. For calendar year 2023, CMS is maintaining its current policy to provide for separate payment for those non-opioid pain management drugs and biologicals that function as supplies in the ambulatory surgical center setting that CMS determines are FDA approved, have an FDA approved indication for pain management or as an analgesic, and have a per day cost above the Outpatient Prospective Payment System drug packaging threshold. CMS is finalizing two technical clarifications to the criteria in the regulation text to reflect their current policy. Under this policy for calendar year 2023, CMS is finalizing separate payment in the ambulatory surgical center setting for 5 non-opioid pain management drugs that function as surgical supplies, including certain local anesthetics and ocular drugs that meet the criteria in Title 42 Code of Federal Regulation 416.174. Behavioral health services furnished remotely by hospital staff to beneficiaries in their homes. For calendar year 2023, CMS is finalizing its proposal to consider behavioral health services furnished remotely by clinical staff of hospital outpatient departments, including staff of critical access hospitals, through the use of telecommunications technology to beneficiaries in their homes, covered outpatient services for which payment is made under the Outpatient Prospective Payment System. Currently, this flexibility is available through the Public Health Emergency Specific Policy, referred to as Hospitals Without Walls or HWW, but the emergency waivers that enable this flexibility will expire when the public health emergency for COVID-19 ends. CMS is finalizing its proposal to require that payment for behavioral health services furnished remotely to beneficiaries in their homes may only be made if the beneficiary receives an in-person service within 6 months prior to the first time hospital clinical staff provides the behavioral health services remotely, and that there must be an in-person service without the use of communications technology within 12 months of each behavioral health service furnished remotely by hospital clinical staff. CMS is finalizing their proposal to permit exceptions to the in-person visit requirement when the hospital clinical staff member and beneficiary agree that the risk and burdens of an in-person service outweigh the benefits of it, among other requirements. CMS is also clarifying that in instances where there is an ongoing clinical relationship between practitioner and beneficiary at the time the public health emergency ends, the in-person requirement for ongoing, not newly initiated treatment will apply. CMS is also finalizing its proposal that audio-only interactive telecommunication system may be used to furnish these services in instances where the beneficiary is unable to use, does not wish to use, or does not have access to two-way audio/video technology. Audio-only communications can help advance equity since many rural and underserved communities lack stable access to broadband services, making two-way audio/visual communication difficult. Inpatient prospective payment system and outpatient prospective payment system payment adjustments for additional cost of domestic NIOSH approved surgical N95 respirators. The COVID-19 pandemic has illustrated how overseas production shutdowns, foreign export restrictions, and shipping delays can jeopardize the availability of raw materials and components needed to make critical public health supplies. The supply of surgical N95 respirators, a specific type of filtering face piece respirator used in clinical settings, was one type of personal protective equipment that was trained in hospitals in the early stages of the pandemic. In a future pandemic or increase in transmission of COVID-19, hospitals need to be able to count on domestic manufacturers of surgical N95 respirators. Sustaining a level of domestic production of National Institute for Occupational Safety and Health or NIOSH approved surgical N95 respirators would help to maintain that assurance. CMS recognizes that hospitals may incur additional cost when purchasing domestic NIOSH approved surgical N95 respirators. Therefore, CMS is finalizing their proposal to provide payment adjustments under the inpatient prospective payment system and outpatient prospective payment system that would reflect and offset the additional marginal resource costs that hospitals face in procuring domestically made NIOSH approved surgical N95 respirators. Under this policy, these payments would be provided bi-weekly as interim lump sum payments to the hospital and would be reconciled at cost report settlement. The rule also outlines the information that would be collected on the cost report to determine payments under this policy, which would apply to cost reporting periods beginning on or after January 1st of 2023. Rural Sole Community Hospital exemption from the clinic visit payment policy. CMS currently pays the physician fee schedule or PFS equivalent payment rate for the clinic visit service when provided at an accepted off-campus provider-based department or PBD paid under the outpatient prospective payment system as a method to control the unnecessary increases in volume CMS had observed for that covered outpatient department service. The physician fee schedule equivalent payment rate is approximately 40% of the outpatient prospective payment system payment rate, and the clinic visit is the most frequently billed service under the outpatient prospective payment system. In order to maintain access to care in rural areas, CMS is finalizing its proposal to exempt rural sole community hospitals or SCHs from this policy and pay for clinic visits furnished in accepted off-campus provider-based departments of these hospitals at the full outpatient prospective payment system rate. CMS believes that implementing this exemption will help to maintain access to care in rural areas by ensuring rural providers are paid for clinic visit services provided at off-campus provider-based departments at rates comparable to those paid by on-campus departments. This exemption for rural sole community hospitals is in keeping with prior CMS policies to provide rural Sur community hospitals a 7.1% add-on payment for outpatient prospective payment system services to account for their higher costs compared to other hospitals. Let's talk about partial hospitalization program or PHP rate setting. The calendar year 2023 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule updates Medicare payment rates for partial hospitalization program or PHP services furnished in hospital outpatient departments and community mental health centers. The partial hospitalization program is an intensive structured outpatient program provided as an alternative to psychiatric hospitalization, consisting of a group of mental health services paid on a per diem basis under the outpatient prospective payment system based on partial hospitalization program per diem costs. Update to partial hospitalization program per diem rates. CMS is finalizing its proposal to maintain the existing rate structure with a single partial hospitalization program ambulatory payment classification or APC for each provider type for days with 3 or more services per day. Consistent with the outpatient prospective payment system for this calendar year 2023 rate setting based on public comments, and in order to protect access to partial hospitalization program services in community mental health centers, CMS is finalizing for only calendar year 2023 and not for subsequent years to utilize the authority set forth in Section 1833T2E of the Act to make an equitable adjustment to the calendar year 2023 community mental health centers ambulatory payment classification payment rate. That is, for only calendar year 2023, CMS will maintain the calendar year 2022 community mental health centers ambulatory payment classification payment rate of $142.70 for the calendar year 2023 community mental health centers ambulatory payment classification final payment rate. Non-PHP outpatient behavioral health services furnished remotely to partial hospitalization patients. CMS is clarifying that the new HCPCS codes being adopted under the outpatient prospective payment system describing certain behavioral health therapy services furnished remotely by hospital staff using communications technology to beneficiaries in their homes will not be recognized as partial hospitalization services but will be available to those in a partial hospitalization program. Specifically, CMS is clarifying that a hospital could bill for non-PHP outpatient services furnished to a PHP patient, including remote therapy services furnished by a hospital outpatient department. Hospitals will be permitted to bill for these remote non-PHP behavioral health services but will need to continue to comply with documentation requirements that apply to PHP patients. Protecting taxpayer dollars. CMS continues to focus on reducing unnecessary increases in the volume of covered outpatient department services by requiring prior authorization for certain hospital outpatient department services. In the calendar year 2023 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule with Common Period, CMS is adding facet joint interventions to the list of services that require prior authorization. CMS believes prior authorization can be an effective mechanism to ensure Medicare beneficiaries receive medically necessary care while protecting the Medicare trust funds from unnecessary increases in volume by virtue of improper payments without adding new documentation requirements for providers. In response to the comments received, CMS is changing the implementation date for prior authorization for the facet joint intervention service category from March 1st of 2023 to July 1st of 2023. This is it for today. Thank you for joining me. Just so you know that I am creating another video on how calendar year 2023 Medicare final rule for hospital outpatient prospective payment system and ambulatory surgical center payment system impacts are hospital outpatient slash ambulatory surgical center slash rural emergency hospital quality reporting programs. So please stay tuned for that video. If you found this information useful, please consider subscribing to my channel. Hope to see you soon. Bye now.